really a great opportunity. I mean, usually someone like me, let me just give you a bit of background. I travel a lot. I'm a manager. I have staff. We have projects in many parts of the world, mostly in the Middle East region. And yeah, I have had many opportunities to talk with senior people, things like that. But I don't get a lot of pleasant opportunities to address young people like yourself. So I really enjoy the challenge. But if you think that the way I present things may be a bit different from what you expected, just let me know, and I will try to arrange myself as I go along, because I don't do that on a day-to-day basis. But what I really wanted to do today is to talk to you about what is more internationally known as the Arab Spring. Okay, actually, in the bank, we are usually a more conservative institution, but in this case, we often refer to Arab Revolution rather than Arab Spring. We can always debate the semantics, whether it's spring in terms of the summer is coming up, but already literature has started piling up here and there. Well, what's happening with the spring is it's missing the summer, and it's already becoming autumn and fall because of what is going on in the region. But all these things should not discourage us, because I believe that in the long run, things will get much better for that part of the world, and deservedly so, and we will touch about to those issues as well as we go along. Okay. Now, obviously, my talk will very much related to the health system, but health systems are part of the general system in any country. It is related to education, it is related to the way the political system and all those things. So I think one cannot separate health and health system, and one cannot take it in isolation without looking at the bigger picture. And I'm just going to show you a video which is from the YouTube, but it's not really YouTube. Obviously, people put all kinds of things in the YouTube, and I'm sure you are more familiar with that than I am. I'm not a very follower of the YouTube. But they put it on the YouTube. This is a video that we commissioned together with a civil society organization based in the Middle East region. And we sent a group to different countries to talk with people on the street what they think of the Arab Revolution and what they think about the health systems, what the problems are, what they should be doing. I think if we start with that, I think it will actually respond, because you will be hearing directly from people from the region, not from me as someone who's the intermediary, but you will see how they see the health system and the overall political economy in general. So let's start with that. It takes about 5 minutes, but I think it is important because you'll be hearing directly from the people, and then I will continue with my presentation.
ربنا يرزقنا برئيس دولة يتقي الله في البلد ويشدد الرقابة على كل الخدمات الصحية والمستشفيات وكل شيء، يعني كل شيء عايزة رقابة. والله أأمل إن البلد يعني تبقى مستقرة ويسودها الأمن. عايزين راجل حاكم عادل، حاكم ظالم.
نتمنى بعد الثورة اللي حصلت وبعد التغيير اللي حصل أن يكون في نوع من التغيير في العقول، في العقلية اللي ناوية تحكم من جديد.
أولا نريد أن ينفصل الجيش عن السياسة تماما. ثانيا أن يكون هناك نظام عدالة لكي يضمن كل واحد حقه، سواء كان متعلما، سواء كان موظفا، سواء كان مزارعا، للجميع.
مهم جدا ان المرحله الجايه تتسم مش بالايمان بالافراد او الايمان بالاشخاص او الايمان بالكاريزمات، لا، الايمان بالشخص اللي هو عنده مشروع ويقدر ينفذه. المشروع 1 2 3 انا هعمل ايه عشان نقدر نحاسبه عليه بعد كده في المستقبل.
المستقبل زاهر، الحكومه تخدم على روحها، الناس متقين، الناس نظاف، لهم سراق، فهمتني؟ هذه ما هيش علي بابا ولا 40 سارق اللي معاه.
والله كان اشتغلت الحكومه هذيا ما عندي ما نستنى منها، كان الصلاه على النبي، واذا تبدلت ربي يجيب لنا ما خير.
بالنسبة للخدمات الصحية زي الزفت، والحمد لله ما فيش حاجة اتغيرت من بعد حسني مبارك ما مسك البلد.
بالنسبة لمدى استفادتي من الخدمة الطبية الحكومية فأستطيع القول أن فائدتي صفر.
والله أقول لك صفر.
ما في لحد دلوقتي ما فيش أي استفادة ولا أي واحد من الشعب هيستفيد غير صاحب الواسطة بس.
المرضى لا عندهم تواليت، لا ملحف، لا فرارش، لا حتى شيء.
أصلا لا يوجد خدمات صحية للمواطن.
الصحة مازالت شوية بعيدة على تطلعات المجتمع.
ضعف الخدمات الصحية اللي يوفروها للمواطن، فما فرق كبير ياسر مثلا بين القطاع الخاص الكلينيك والقطاع العام.
هو هنا ما فيش خدمات صحية وعلاجية للشعب المصري اللي هو الفقير. هنا اللي معاه فلوس بيصرف، بيروح مستشفيات خاصة ويروح لبره ويسافر هنا، لكن الفقير ما بيخش علاجات خالص أصلا.
معروف إنه في أي دولة في العالم لها سيادة وقانون أن الصحة لها مراكز حكومية بالمجان.
أي واحد مسؤول بيتكلم في التلفزيون يقول لك المستشفيات كويسة، ينزل معايا هنا أهو واخد اروح اي مستشفى واكشف كده، واخش المستشفى واكشف ويعرف على الطبيعه. لكن كلام انا ما بخش بالكلام، انا باخد بايه؟ بالفعل. تعال معايا اي مستشفى اوريك ان هم بيعاملوا الناس ازاي، ومفيش علاج مفيش اي حاجه.
لم يتم معالجة الفساد الصحي، ولا زال الفساد الصحي والطبي قائم حتى اللحظة.
ولكن بعد الثورة أعتقد أنه كان في إقالات كثيرة، وأعتقد أن الناس فاقت.
الفساد كان كبير ياسر وستركتورال يشمل الميادين الكل، يعني فساد عام.
النظام السابق كيفاش يتصرف راهو كيفاش منظومه فاسده 1000%، يعني لازمك تبدل الراس الكبير وانت هابط.
معناها فما رقابه، لجنه، الناس الكل تتحاسب، معناها كسوا المسؤول الكبير الصغير.
الاقتراحات هو الضمير، اصل كل الناس هتتكلم عن الضمير. هو اذا غاب الضمير غابت كل شيء، واذا حضر الضمير حضر كل شيء كويس ان شاء الله.
ولابد ايضا من اضافه عده خطط وظيفيه في المستشفيات تستجيب الى دوما تحسين عمليه التواصل وتأثير الاعوان وتأثير المرضى.
طرق معالجه، كل انسان يخدم خدمته.
أطلب وليس أتمنى، أطلب قليلا من الأمان، وهذا أقل شيء ممكن أتمناه في هذه اللحظة.
آمل بأنه فعلا يحصل تغيير، مش بس كلام أو ثورة كذا بس أمام الناس، لأن الناس عملوا ثورة إحنا كمان نعمل ثورة. لا، أشتي هذه الثورة تكون فعلا نابعة من صدق من قلوبنا، وتعمل فعلا تغيير، لأنه فعلا نشتي كلنا تطور.
Okay. So, this is a snapshot of how people perceive the changes in the region, and how they also see some of the problems in the health sectors. Obviously, there are generalizations, and sometimes there may be even some exaggerations as well. But I have been working in the region for a number of years now. I have had the chance to visit many parts of that part of the world, even some remote areas. You know, some people think that the World Bank always go and stay in 5-star hotels. Yes, we do. But on the other hand, we also go to the field and meet with people and talk with people as well, and visit some of the really distant, far away places. And I think my experience has been that there is a lot of truth in what they have just said. and there were some keywords. If you do some kind of a discourse analysis of what they said, you will realize they are referring to corruption, they are referring to accountability, they are referring to inequalities in health. They are referring to financial barriers, they are referring to other kinds of barriers in access to care. And I'll try to show you some data as well to make those points. But I think, yes, generalizations apart, there's a lot of truth in what they said. And I think one of the reasons why I said that the talk should be called what Arab Spring has to do with health and what health has to do with Arab Spring, they are really interconnected. I think people, especially in the education sector and also in the health sector, they were really pretty much fed up. Now, again, I don't want to generalize. The MENA region, as we will go along, is a big region. So let me try to talk about a bit how I structured my presentation here, and then I hope that I'll be able to finish it in half an hour or so. And after that, I'll be most happy, because I think it will be the most interesting part of this for me, to see how you react, what kind of questions you will have, and we can have some kind of a discussion. So I'm going to show you a few slides on MENA, because you need to understand the context. Not just the political economy, but context. What kind of countries are we talking about? Then I will show a few slides to you about the health and the health systems in the region. Again, there will be some averages, there will be some generalizations, but I think they are quite accurate in terms of telling you how the situation is regarding health and health systems. Then get into the health system governance issues and what are the key issues in terms of institutions building, in terms of making governments more open, making them more accountable, applying the rule of law, not necessarily just in the health sector, but health sector is a big part of that. And one of the reasons is because health services, unlike other services, are often non-discretionary. So when you get sick, you need the services right away. You cannot say that I will buy it in 1 month time and I'm going to shop around on the internet to see where I will find the best quality and the price, right? So there is a bit, therefore, when there are frustrations, that people cannot get what they need, obviously it becomes part of the overall dissatisfaction, and we believe strongly that there is good correlation between the people's uprising in some of the countries in the Middle East and the dissatisfaction with what they receive from the public healthcare systems. And at the end, I will make some concluding remarks, of course. So let's start with the MENA region. Again, we need to be careful. We cannot really generalize. At least the way we define the MENA region in the bank, which is a bit different from how the other UN agencies they define. According to us in the bank, we have 20 countries that talk about 355 million people. But within the MENA region, there are at least 4 clusters of countries. You have rich countries, we call them the GCC countries, which are here in blue. They include Saudi Arabia, Qatar, Oman, Bahrain, United Arab Emirates, and Kuwait. There are 6 countries. They are rich in economic terms. Their GDP per capita will be quite high, something between $30,000 per capita to $75,000, $80,000 per capita in the case of Qatar, for example. But they don't necessarily have the strong institutional setup, therefore they still need some assistance internationally from institutions like ours. Then you have middle-income countries, which are in the red here. By middle income, I usually refer to countries where the GDP per capita will be something between, let's say, $1,000, $1,500 up to about $10,000. But in our region, it's mostly on the lower end of that, except maybe in Libya, where it is a bit higher. Then we have also poor countries. We call them low-income countries, which are in our region, Djibouti and Yemen. In these countries, they're really poor. The GDP per capita will be less than 1,000. I mean, in this time and age, less than 1,000 is really very, very little money, and they are really poor. And you will see some of that in the statistics as well. So it's a very diverse group of country. Another characteristic that we need to mention, it is a fragile region. It really is. I mean, it has never been free of war. There has always been some kind of an armed conflict here and there. And I think this is something we have to keep in mind. people have that in the back of their mind. So many people in some parts of our region, and they leave home in the morning, and people worry whether they will be able to come back in the evening. I think it is important. If it is part of and parcel of your daily life, you have to factor that in. Obviously, we have some countries where they have abundance of natural resources, oil and natural gas, especially on the GCC side. But many other countries are actually importers. So the whole Middle East is not just rich in oil or gas. Many of countries actually are importing a lot of that and spending their precious cash in getting those things, and then they are subsidizing that. I will touch into that later on. And another feature in this region is, for example, if you go to Algeria or Libya or Saudi Arabia or even Egypt, there are places where you have large cities with very large populations, and then there are big areas of the countries where there is almost nothing, in a way. And that is important too, because especially in the health sector, you want to plan, service delivery in such a way that you will be able to reach most of the people regardless of where they live. This is ideal, of course, but it's something you have to keep in mind as well. In those countries, it happens quite a lot. I'm originally from Turkey, but I'm also Canadian, lived in Canada many, many years, and in Canada it's like that too. You go to the northern part of Canada, there are large spaces where you have almost no people, and then you have to find a way to bring health services to these people. Okay. So, a bit of information. In this region, we have what we call long-standing vulnerabilities. If you look at, yes, they are rich in oil, but they are very poor in water. There are very few water resources, and it's going to be a big problem as we go further, as the populations increase. This is a region that is the least endowed in terms of water. If you look at the statistics, here I showed you some slides, look at the Latin America and the Caribbean region on top, how much water they have, renewable sources, in terms of cubic meter per capita per year, and look at the MENA region, which is at the bottom, which is about 1,000, which is very little. If you look at another factor that we have to keep in mind is the gender issue. Then you look at the gender situation in our region. For example, what is the level of active participation of women, whether it is in politics, in social life, in different professions, etc. You see some gaps that you don't necessarily see in other regions, and there is some data again. I'm just mentioning them very briefly for you to have some sense of the region. If you look at some of the governance indicators, whether it is voice, accountability, and things like that, you'll find that this region also is coming from behind, especially when it comes to giving people voice and choice and representation. Those things are also lagging behind from other regions. And then the energy and food subsidies, a big problem in our region. Why I'm saying this? Because in most of the countries in our region, governments subsidize heavily food prices and oil prices. This is in a way they thought that they will be able to keep social peace by giving people highly subsidized oil. That means, for example, in the US you are paying what? $4 a gallon, right? For gas. Okay? Is it subsidized by the government? No. But in this region, some of them are oil importers, but they sell it at a lower price because the government makes up the difference, but they pay it from their own budget. That means that it has implications for the fiscal situation in the country. And they do that for the food as well. The reason I'm showing this particular graph, and you see that some countries like Egypt, for example, and Yemen, it goes up to 8–9% of the gross domestic product of the country. Now the problem here, if you are driving a Mercedes, you are getting food subsidy. If you are poor and you are driving a motorcycle, you are getting the subsidy too. As your Mercedes burns more oil, gas, then you are better subsidized even though you are rich. So the idea here is that these subsidies, while they cost a lot, they are not progressive in nature, and it doesn't necessarily target the poor. And this is important for us because we work a lot on that in the bank, how target them better so the poor will benefit from the subsidies rather than everyone on an equal basis, but not necessarily in an egalitarian way. Okay? Okay. In terms of socioeconomic progress, yes, there has been a lot of progress. Life expectancy has increased, under-5 mortality rate has come down, maternal mortality rate, except in a few countries like Yemen, in some rural areas in Tunisia and Egypt, etc., has also come down. But And also in terms of absolute poverty, which is basically $1 per capita per day, is relatively low in our region. And one of the reasons for that is the solidarity and social structure, social networks that we have. The families are close by, people help each other. You finish university, you are out of work, you don't have money, but you still stay with your family, they help you out. So the absolute poverty is not that high. But there are lots of vulnerabilities, as the lower left-hand side of the slide show, because there are a lot of people living on the edges. Why it is important? Because the moment there is a financial crisis, and there is another kind of crisis, like what is going on in Arab Revolution. For example, in countries like Tunisia and Egypt, there has been major reduction in tourism revenues. People don't go there. These are big revenue sources for those countries. Then obviously the fiscal space gets narrower, and many people get out of work, especially seasonal workers in the tourism industry. They are informally employed, then they suffer the consequences. So there are lots of vulnerabilities. People can quickly fall into poverty because they are very much on the edge. So what are the key development challenges? I think there are a number of them. I put there malnutrition, which is quite an important thing. Again, I'm talking in general terms. You have all the data per country and also compared with some of the other countries. But in places like Djibouti, in Yemen, parts of Egypt, malnutrition is quite a problem here. I mean, this is obviously 21st century. We are in 2012, and people are suffering malnutrition. In some places, acute malnutrition and also chronic malnutrition, which is experienced obviously through stunting. People don't grow up. Their height for age is lower than what you would expect. Right? That's what I mean by chronic malnutrition. Then. Also, there are disparities. If you look at, for example, the slide which will be on your upper right-hand side, it depends if you come from an urban area or a slum area or rural area. The level of education you attain also varies a lot. So there are these kinds of inequalities as well. Another issue, and this is a very big issue in our region, is unemployment and unemployment of the youth. This is quite complicated because in many of these countries, and you will see that a bit in some of the Latin American countries as well, they keep people in school as long as possible, simply because when you are in school, well, obviously you are preoccupied, you think that you are learning something, which is good, obviously. You delay your entry into the productive life and finding a job, etc. But then, you graduate eventually, okay, and then you find yourself out of work. While you studied 4 years, 5 years, at the expense of the government, but the skills that you have been imparted with will not really help you find a good job. They ask you, what are your computing skills? What are your analytical skills? And you don't have much to show for. And then you fall into that situation where you are totally dissatisfied and disenchanted. And a lot of literature is coming out right now from social sciences showing that one of the reasons behind the Arab Spring and Arab Revolution is basically educated people revolting, saying that we educated ourselves for so many years, and now what's happening? You have no skills. What is it that we are going to do? Where we are going to work? Again, I'm making some generalization, but I think that's quite a big picture. If you look at the data, for example, especially for the unemployment rates, first, it is higher in young people, especially 15 to 24, and also it is very high in university graduates as well. And if you compare especially with other countries, one complexity here is that in the Arab world, compared with other countries, female labor participation is less. So often, actually, a lot of women study, they educate themselves, but not with the intention of finding work, rather than to, upgrade their social status and maybe marry into a better family and having better life, or providing better education for their own children, but not necessarily finding job in the. Despite that, there is less pressure on the labor market per se, because some of the women take themselves voluntarily out of the labor market. There is very high unemployment, and that is a major problem. I think I will come to that later on. It is a major area of emphasis for the World Bank to focus on, and there are a number of ways we can do that. And also, the other thing is I just mentioned briefly the informality in employment. So a lot of people, I mean, we have that a bit in the United States too, but a lot of people are informally employed. They work 3 days and then they don't work for the next 3-4 days. They work 3 months in a hotel in summer but not in winter. You know, they get these kinds of jobs without necessarily any chance for them to go up, advance in their career, but also have some kind of the basic benefits and security that more stable jobs will bring. Okay. So this is more or less the situation. In summary, we have this youth bulge, a lot of young people. Many of them are relatively well educated in terms of being college graduates. Unemployment is a big problem. We have the gender issue as well, and there are also disparities in access to education and to better life. Okay, I just mentioned the youth. This is the situation. I think in terms of the relative size of the young people to the total population is very high in MENA. Although, unlike in some circles where they say that, oh, this region is growing up and the total fertility rate is so high, there are going to be billions of people in Middle East, etc. I wouldn't give too much credit to those kinds of things, because if you look at the demographic projections, total fertility rate is coming down in most of our countries. Obviously, there is a cohort effect, because the people who were born in 60s and 70s and 70s and 80s and 80s and 90s now, as they reach the reproductive age, by definition, bigger denominator may bring more people. But I think there is a trend that there is a decrease in total fertility rate, and eventually these populations also will start aging like many more developed parts of the world. But we have a bit of a situation that you often find in transitions. You have, I referred already to that, to malnutrition on one hand, but on the other hand, we have also obesity, especially in females. That is quite particular to our region. It's partly related to the social situation. Women being less active, having a life outside the house, it affects obviously their behavior, etc. And we have this actually in many countries, the situation whereby people getting more and more obese and eventually ending up having diabetes. Again, I'm speaking in general terms. The numbers are different. In some countries it will be 30% of the adult population, in others 20%, in others less. But overall, if you look at it, it is more common in women, especially in those who are doing a bit, who are better off, economically speaking. So on one hand, you go to a country like, let's say, Egypt, you have on one hand malnutrition somewhere, on the other hand you have obesity as well that you start to think about. And actually, that's what is happening. We are predicting that non-communicable diseases related, disabled-adjusted life years measured in millions, will increase more significantly so in our region, in MENA, than many other parts of the world. If you look at this side of the graph, and you look at the numbers here, this is what we expect. We expect about 40% increase, measured in DALYs for non-communicable diseases only, the increase over a span of 20 years, and this is something which is going to happen, and actually it is important for the health system to prepare themselves and to prevent it as much as possible. So this is basically, as the population are getting older, we will have, given the lifestyle, given many other factors, living in obesogenic environments where you don't have good public transportation, where you don't have parks, people cannot go out. All those things, you put it together, you will find that the situation will not necessarily get any better. Just a few slides on the health financing side. Now, this region again is interesting because it's one of the regions where you see, for the level of economic development in general, people spend a lot of money out of pocket. And most of that money spent out of pocket is basically spent at the point of service, not because they buy private insurance. Okay? So these the two sides of the slide, one is private health expenditure, which basically in the way it is defined, it includes both prepaid health insurance plus out-of-pocket, and this is just out-of-pocket at the point of service, and the difference is very little because people do not necessarily buy health insurance privately, so and for all kinds of reasons, and when they get sick, they spend out of pocket. And if you look at the numbers, for example, Egypt now here, it shows this is slightly outdated. This is 2009. It is below the 60% of how much they spend. This is out-of-pocket health expenditures as a percentage of total health spending. So if the country spends $100, that means that $60 are spent privately out of pocket. 40% will come from government or other health insurances. In Egypt right now, it is 75%. So 3/4 of every dollar is spent out of pocket. In a country where you have poverty, quite expensive. So I think this is something keeping in mind. And think about the Arab Revolution as well. Okay. And actually, if you look at how much the government spent and put in contrast the out-of-pocket expenditures with public health expenditures, you realize that in many of our countries, except the GCC where they have more money, they actually spend very little money as percentage of their GDP from the government budget on health. So it is not really a priority. You go to OECD countries where you will usually find 70–75% of total health expenditures being on the public side, except the US and maybe some other countries. And but in most of the countries, in the OECD and more developed countries, you will find out that the government spend 5, 6, 7, 8% of their GDP on health, right, from the public purses, and the rest being paid. You go to UK, it is 85%, for example, of the total health expenditures, which will correspond more or less 6.5% of the total of the GDP being spent out of by the money coming from the public sources. So in our region, you look at the government budgets, which we do a lot in the bank. You realize how much money they put into education, into health, into social things. It is not that much. And yet they put a lot of money on what? On subsidies, which benefits everyone across the table, but not necessarily the poor, the needy, etc. So here, a few slides. They are in French. I'm sorry for that. I didn't have time to translate. This comes from a survey we conducted in Morocco. Basically, they are asking people their level of dissatisfaction with services, what percentage of the people are dissatisfied, and there are a number of services. It's respect for intimacy, integrity and honesty of the professionals, the level of hygiene in the facilities, the attitude of the health professionals, and all kinds of things. And you realize that how high it is, that the level of dissatisfaction with different aspects of healthcare, from entry to the facility until you exit. And the rest of the slides show what is called informal payments. But people basically are not supposed to pay. They are supposed to receive these services free of charge. And you saw some of the people in the video referring to them. And yet they still pay. We call it under the table payment. They pay the doctors, they pay the receptionists, so they can jump the queue, or they can have a better service, or someone will smile to them and they see them. Okay, look at the numbers. It's quite high. So this is not only particular to Morocco. We see that in other countries as well. I think I saw this data and I was very encouraged when I see that. Not because of the numbers, they are not obviously encouraging, they are discouraging. But the Moroccan government decided to create an entity which will measure the degree of corruption in different sectors, including the health sector. And they were part of this survey, and they actually put the results on a website, and they made it public. So this is a great positive step. Often you can't really have this access to this kind of data. People will not tell you during surveys, out of fear, out of retribution. But the fact that these things have started to happen, because obviously you can only improve things if you can count them, right? So if you start counting them this way, you can eventually improve. So this is a step in the right direction. Okay. And coming to health outcomes, and just 2 slides looking at the under-5 mortality in a number of countries in MENA, and the birth attendance. Again, you see a gradient between the rural and the urban, between the lowest quintile income group and the highest quintile income group. And sometimes the differences are quite drastic. And a few more slides. These are coming from surveys in Egypt post-Arab Spring. And when you ask people, what are the two things that the government should be investing more? Look what comes first. Education, of course. This is mostly in terms of quality, not access. And the second one is healthcare. Okay? And if you ask them whether they're having any changes in their perception on a number of sectors and government activities, if you look at healthcare, 48% of the people say that it is more or less the same, but another 38% of the people say that things are getting worse in terms of access to healthcare. Let me get this slide. It's just I put it to show you that how much we expect these countries to spend on NCDs as the population gets older. And this slide, I only put it here just to show you. We are about in 2012, so we still have in this region a young and relatively healthy population, but they don't necessarily have the healthy behavior. As they are getting older and they reach adulthood and late adulthood, we are expecting them having all kinds of health problems, mostly related to non-communicable diseases. This will have not only health, obviously, consequences, but economic consequences. There will be attrition. People will be, not working for a longer period of their productive years, and they will be costing a lot to the system, etc. So I think one of the things that we want to do as the bank, but not only us, with many other partners, is to find a way how we can take this youth bulge, relatively healthy now, and we move with them over the next decades, but we keep them healthy and productive. And what is it that we need to do in order to achieve that? And this is the biggest challenge for the governments, but also for international agencies like us. So it has to be strategic in the way what's going to happen in the next 30, 40 years. Okay. Let me say a few things on governance. I already showed you one slide on the governance. This is obviously not in the health sector only. It is across all sectors. These are the key elements of governance. To what extent the civil societies are active, how fair the elections are, whether the government is accountable for its actions, for its performance, whether the administration and the civil service are applying the rule of law, and to what extent there is oversight regulation, and to what extent there is active enforcement to prevent corruption and things like that. And all those dimensions, you will find that in many countries we are doing a bit less than others. So this brings me to the governance part of my talk. The way we conceptualize governance in the bank, we see it as it is composed of 4 building blocks. You have what we call the government accountability. Then you have institutional and state building. You have open government, mostly in relation to transparency, etc., and the rule of law. For any government to work properly and to be effective, you have to be able to do all those things well. Okay? But what we are having is this at this moment. So we have very little involvement of the civil societies, at least until the Arab Spring, and now things are getting better, especially in countries like Tunisia and Egypt. I'm seeing it with my own eyes. I'm meeting CSOs, etc., which is a very encouraging development. Obviously, corruption and state capture, secrecy, information asymmetry, administrative discretion. If you know someone, you will get better treatment and you will get your driving license in 1 day. If not, it will take you 30 days. Patronage and nepotism, weak institutions and procedures, lack of performance quality, and public spending inefficiencies. I talk about the subsidies and low capacity. Right? Okay. Now, obviously, these are big statements. It doesn't mean that they are absolute realities in all countries everywhere, because we don't want to be unfair to lots of millions of people who work in the government in those countries who are trying to do a good job while being paid $50 a month. Okay? So we don't want to be unfair there. But I think for the sake of this discussion, we need to keep in mind that these are the kind of issues that we are grappling with, that we are trying to reduce the incidence of. So, let's see some data. Okay. Again, without making sweeping generalizations. If you look at, for example, this graph is interesting. If you measure quality of administration, okay, per capita GDP, the level of GDP, this line is the line for the world. Okay. So as countries get richer, okay, the quality of administration is also improving, and there is, a certain relation there. A regression analysis, you have a coefficient. Okay. If you do that for MENA countries, this is the line. So basically what you have here, there is a gradient. For the same level of development, you have poorer quality of administration in our region. So again, without generalizing too much, this is the reality that we have to deal with. Okay? So why a country in Asia, which has $10,000 per capita, okay, performs at a level which is quite superior to the level that another country in the MENA region, which also has $10,000 per capita, perform. And are they structural? Are they behavioral? Are they sociocultural? Or what the reasons are? And I don't necessarily believe that it's sociocultural. I don't, because if I did, I didn't work in development. There are other reasons. We have to look at the incentive systems and other things, and we have to try to figure out what are the reasons behind that. I think the reasons, if you go back to my before building blocks of the governance, you will find them there. If the information is kept in secret, you don't know whether the government is performing well. If the finance department will not tell you how they spend their money, if they don't tell you that they have open tenders when they are buying drugs, okay? And you don't know who gets the contract, whether they get the contract because they are giving the lowest price, or they are getting the contract because they are connected to someone. And this is basically what we are talking about. And those things, as they improve, I think you have a lot of room for improvement in any country, not only in MENA. I talk about the state and institution building. This is a slide that I like a lot because to me it summarizes a bit the nature of the relationship, the nexus in the healthcare system. You have obviously population and consumers of healthcare, you have the providers, you have the payers, and you have in the middle the government, in a way, right? Or some kind of an entity which oversees that. I think what is important here is to what extent there is a distinct separation of responsibilities for different functions of healthcare. If you are providing services, you own the hospitals, you manage the hospitals, you hire the doctors, okay, and you are supposed to be monitoring their activity, and you also pay at the same time, which is not good. We believe in the separation of responsibilities for functions. So by state and institution building, we refer, for example, whether they can have separate entities, whether it's a health insurance model or a health system like the British Health Services model, whether someone has a distance from the provider so they can go and contract out or actively purchase services from hospitals, from health centers and things like that. And they do that in a transparent manner by getting good quality and good mix of services for the money they spend on. If you see, just give you an example, that the Minister of Health in country X in the Middle East region is also the chair of the Health Insurance Board, do you think that this could happen? This will not happen. And this is what we are talking about. So separating these institutions, making sure that they develop and they have full competence and the freedom and independence to perform the function they have been set for to begin with. And it's separate for financing, it is different for service delivery. Okay. Again, why open government reforms? This was one of the building blocks. I'm showing data for each of the building blocks, right? So if you look at it, public access to information. Look at the MENA region compared with the rest of the world. How low scoring it is. If you look at the open budget index, what is open budget index? In many countries, the governments actually publish on the internet their budget. They say at the beginning of the fiscal year, this is what we want to spend our money on. Okay? We are spending $4.3 billion for education. And at the end of the year, they say, well, we couldn't execute the budget the way we planned. We spent only 90% of this money. And then you can tell them, okay, what did you do with this money? Well, they will say 60% of the money went to salaries of the teachers. Okay? Well, but the teacher attrition rate or no show for work is very high. What did you do for that? Can you get answers to that? So I think the idea here is really making this transparent and open so that you can keep them to account. It's an accountability issue related to openness, obviously. If you look at the press freedom index, this number for Tunisia is a bit outdated now because they passed the law of freedom of information, and I think the law, at least in theory, is, the press has become very free. But if you look at the score they have, obviously the higher you have the score, the more unfree the media is, you find that in most of the countries, except in GCC, these scores are relatively high. But even in GCC, I mean, there is more freedom as well, but there are still some taboo subjects that you cannot touch much. Okay, so it's not that you can say anything you want in the press. And the rule of law. You have some data from the Corruption Perception Index, the country's ranking. If you look at the country ranking, this is globally obvious, the best country, the best performing country in our region, so the least corrupt is Qatar. It comes 22nd. But look at the listing. Look at for Iraq, for example, which is 175th in the world. It's probably one of the most corrupt countries, at least as measured by this index. They score 1.8 out of 10. Okay? So this is also the data to come back to my 4 building blocks of governance. And this is what we want to do. Let me show you. It is a bit of a complicated slide, but actually these are all the things that you have to do. And trust me, even though I don't necessarily refer to health sector, health system per se, in all the boxes that you have here, there is something to do in the health sector as well. Okay? For example, improving access to quality of public services. It can be people getting their driving license, but it can be also receiving primary health care. Okay? If you are talking about access to information, if you go to a health center, if the health center says that, okay, this is our price list. These 5 services are free of charge. The next 4 you pay 10%. And you know what you are expected to do. But it's not like you go to talk to the receptionist, depending upon who you are, he tells you you have to pay $10 extra for this service. And if you say, but I thought that it was free, well, it is not free here. That is the answer you get, right? Okay. So you can improve on those things. I refer to clarifying core government functions, how to separate, for example, financing and service delivery. Developing a level playing field for all citizens and firms. In many of our countries, if you want to invest in the private health sector, you may have difficulties depending upon who you are. Okay? In some places, you can get a carte blanche to build a hospital, and in some other places, you may not get that. Okay. And the rules will not be the same for you or someone else. So these are the kind of things that we will have to invest. So this slide for me is very important. It has huge health sector implications. In each of the boxes, I can give you a lot of examples how it applies to the health sector as well. But I think everything starts here. That's why in the title of my presentation, I use the word governance, because without good governance, you can have efficiency, you cannot have equity, you cannot have responsiveness, you cannot have patient satisfaction, and you cannot improve health outcomes. This is where everything starts. So, very quickly, this is what we want to do in the bank. Now I'm talking as a bank person. This is our regional strategy. We believe that the bank should focus on strengthening governance. I hope that I've been able to convince you why we have to do that. Obviously, we need to accelerate growth in a sustainable manner so that you can reduce unemployment, especially among the youth. We need to ensure economic and social inclusion. It's a bit of a code word saying that we want to make sure that there is no gender discrimination or other discrimination, so we include everyone who are citizens, who have the rights. And then obviously create lots of jobs. So these are the 4 building blocks of our regional strategy, and you can find health in all of them as well. And this is something that we are planning to do. I don't want to get into detail, but it shows you all the areas that in the health sector we want to be involved. Obviously governance is a big part of that. You want to build and strengthen health systems, institutional architecture, or also make the governance of health systems more pluralistic, meaning that more active participation by the consumer groups, by civil society organizations, etc. But again, I will not go into too much detail. Now, let me finish off by saying, governance is not new. This is a fresco, basically painted by Ambrogio Lorenzetti, which is on display in Sala de Nove, which means that the Hall of the Nine, which were the 9 governors at the time, in Palazzo Pubblico in Siena, Tuscany, Italy. It was drawn in 1330, okay, more or less. He had a number of things. And even at that time, he understood, and or at least the rulers understood, because in Middle Ages, in Italy especially, most of the paintings were commissioned. The people didn't do them, they didn't have the luxury, but someone commissioned, paid for it, and they did it. And these are the commissioned work of this particular painter. He called this allegory of effects of good and bad government. So this is good government, basically meaning that everything is in order. There is a ruler, there are people around that. You see that there's a sense of order in the picture, right? And then, this is, next to that, what he calls the good city. So good governance, good city. So if you look at this, people are properly well-dressed, they walk hand in hand, there is a certain sense of security, business is going on, construction and things like that. This is what he drew in 1330. And this is what he calls bad governance. So if you look at the ruler, almost looking like devilish, around people doing all kinds of things, some bringing some stuff probably for favors to him. And I put another picture on the side, which comes from the same thing, basically 2 soldiers harassing a woman as a citizen. So what we are saying is not really new. It has been there, and many people understood that, even in the Middle Ages. But what we really need to do in our region is to make sure that we invest heavily in governance in every possible way. Because this is a great picture of the Tahrir Square in Egypt, with millions of people chanting, okay, and asking for dignity, respect, and freedom. This is good, but we want the society to move on from that and have better governance so that we don't have this repeating every 50 years or so, with a big risk of disruption to social order, but also with huge financial and fiscal implications. Thank you very much for your attention.